is lacking. So how do we put our head together and ensure that the people that are being enrolled get the services that is required of them? Thank you.
Mr. Commissioner and the technical committee, my name is Pharmacist Simon Gonji. I'm the past chairman of HEFON and past chairman of Pharmaceutical Society of Nigeria. To corroborate my support for Plachema presentation on the Ghana model, which my brother has spoken much about, I want to actually say that indeed it's a memo that will work very well in Nigeria, because I remember HEFON joined NHIS in 2010 to support community-based insurance somewhere in a community around Lapai in Niger State, and it worked very well. Also, yes, the day before yesterday, I mentioned a community in here in Plateau. I think I saw pharmacist Lenka. I think he can tell us more. Indeed, that community, they started it, and I tell you, the sons of the soil paid for most of the most indigent in that community. And I think if we introduce it, our people will support it. But the question and pose I will put to Plachema is whether they have in their model the HMO. I believe the HMO can do to encourage this, and whether if they don't, then a strong advocacy is needed. Thank you very much.
Do we still have some people? Wow.
The Honorable Commissioner, sir, my name is Maria Power, the SASCAP coordinator. I want to support the memo presented by EPIN on sustainability. Yeah, rightly, we know the process are ongoing, assess. And it was presented during the health sector symposium, which the Honorable Commissioner and the CMD and Professor Agwajo, who is the chair of the integration, of which Plateau State was rated a bit poor. We are not doing well in services integration. So I thank God that all the key stakeholders in the health sectors, they are in this room. So it's a wake-up call for us that after this meeting, there is need for us so that we'll improve on the services integration, not just the ATM alone, but including non-communicable diseases, to include hypertension, diabetes, and cardiovascular diseases, because it has been discovered that people living with HIV, they've been long on ART, of which they are living long, and then they are coming down with other non-communicable diseases. So, thank you very much for the opportunity and then the presentation, just as an information memo. Thank you so much.
Adam, thank you for your support.
Honorable Commissioner, sir, I remain Philemon Dagwa, the State Neglected Tropical Disease Coordinator, Plateau State. I humbly support the memo, but with that addendum, the need for Plachema to discuss with the DG, NIM, for you talk about capturing the beneficiary, the aged, the vulnerable, and the less privileged. If you've not discussed with the DG, NIM, I think this memo, even if it's been passed, we will go back to square one. The first thing is discuss with the DG NIM, then let's have the way forward. Thank you. This is my submission. Thank you.
Please, we are going to take the last three hands at the back so that we meet up with our time.
Hospital Management Board. And I stand up now to put my comments and observation and contributions to 3 memos that have earlier been presented. First, I want to submit that I support completely the memo that is presented by the Honorable Member of the House of Assembly, which intends to put a legislative backing and set the guiding principles to some of the memos that already have been presented yesterday and even today. I want to say I fully support that. On the other hand, I want to also comment on the memo that was presented for sustainability by the APIN team. And I want to add to this that I've also listened carefully to the comments that is made by other participants in terms of ensuring that other disease entities are taking place. I want to add this to the prayer of that memo, that the time is now to set a steering committee that would oversee integration of HIV and other diseases in the state that would lead us forward. And so this committee will come up with a framework that is supposed to present a state-led HIV programming or disease programming for the state. I think that is, and with regards to the plasma memo on the Ghana model, the intent to, I think it is within the mandate of plasma to implement strategies that intend to improve coverage of Plateau State's indigent on insurance. However, I want to consider this memo as just an information memo. Plasma should go back, have a part of this model, whether it be a mixed model that someone has suggested, and then they can come up for support of the council maybe next year on this memo if they want to scale it up and they need support of funding or otherwise of the council. Thank you. This is my contribution.
Thank you. Okay, we're going to have the 2 live speakers.
The Honorable Commissioner, distinguished stakeholders, my name is Pharmacist Joshua Davuruk, the State LMCU Coordinator. My office is responsible for the integration, management, and coordination of the logistics of all public health programs. What I want to say, I think a lot of speakers have spoken about it, but just to briefly say that whenever we're talking about sustainability, it's better we see it from a comprehensive perspective, not just HIV program. We have about 9 programs, and all of these programs are currently experiencing partner fatigue. So I think if the state will do anything, let us approach it from a comprehensive perspective. I know what my office is going through currently because I manage the logistics of all of this program. And we sincerely want to appreciate the Honorable Commissioner and the state government for stepping in, but there's still a lot of gap. And I want to add that please, whatsoever we are doing as a state, let's know that there's also a move from the federal government. In fact, I am part of a committee, 5-man state committee, and that is studying the gap.
The last speaker.
Okay. Thank you, Honorable Commissioner and distinguished stakeholders. My name is MLS Lillian. You know, I want to add to what Pharmacist Pan said about the hepatitis. My organization is privileged to do outreaches in the communities, and we do free hepatitis testing. One key thing that is standing out is lack of knowledge. A lot of people tend to know more about HIV than they know about hepatitis. And hepatitis, the number of reactive people are increasing in the plateau. Another challenge is this. A lot of reactive patients they can't afford the basic test to go and do the profiling. So I am adding to what they said, if they can be added to the group of HIV, and so that they can receive help. Then another thing I want to say is the place of vaccination for hepatitis. There are some adults can be screened. These people are willing to pay for their vaccination, to be vaccinated against hepatitis B virus. But when they approach our PHCs, they will tell them that it's only for children. Please, if that can be looked into and provision be made. Thank you, sir.
I think we have done justice to the 6 memos in terms of comments, observations, supports, and otherwise. There were 2 questions that were raised to Plus Chairman. I will call Plus Chairman to come and attempt the questions that were raised.
Okay, Chairman in Council, distinguished Council members, I would like to really appreciate members of Council for listening very well to our memo, and so I'll go straight forward to really comment on the issues raised regarding the memos that we've submitted to Council for considerations. There are actually 4 questions that are targeted at us. I've jotted them down very well. The first is about the community-based health insurance, and on whether we've actually looked at literature and what evidences do we have on how it would actually scale up deepening health insurance here in Plateau State. Now, in one of the schools that I attended, we had very profound academics who have studied extensively community-based health insurance, and we've had several sessions on how community-based health insurance will not actually work. Now, what I'd like to bring here for us to look at is whose evidence are we basing our workability on? Have we generated our contextual evidence here? Now, I want to bring some very important points that would actually make community-based health insurance workable in our environment. Some of the frameworks upon which CBHI is built on includes, number 1, community solidarity, because this system is actually developed within the context where individuals actually live. So, and in our environment, we have contextual variables that will support the viability of CBHI. We have community development associations. We have ward development committees within wards. Number 2, it's about trust. This is something that it's going to be involving people. They will look at it as something that they actually own. So that would actually deepen accountability, you know, of this structure. Again, within our context, we know that most of the commodities and consumables that are required to deliver on primary care component of our basic minimum package of health services are actually provided by governments. For example, the treatment for malaria, the drugs that are involved in treatment of malaria, and the commodities are actually supplied by the malaria program. So we will create a situation whereby we will incentivize communities, okay, that key into CBHI, so that we're going to be enrolling individuals based on the wards where they are actually domiciled. For example, you know, one of our prayers is to actually pilot the workability of CBHI. So we'll look at a particular ward and identify individuals who have the financial wherewithal within those communities to see how they can contribute a premium that will enable us enroll the entire members of that particular ward. Thereafter, we will use the equity fund that the state government intends to give us, and which we are already collecting at this particular point in time, to incentivize referrals and secondary care after primary care. So I think we are going to try CBHI using a combination of the Ghana model as well as the Rwandan model,
and contextualizing within our operational environment to see how we can scale up health insurance coverage within our system. Again, we also have very viable experiences, even in this hall. Pharmacist Gondi talked about their experiences at Hereford in Niger State and also the one here in Plateau State in Shuer. This is going to be a very viable resource for us in the state, wherein we're going to create a CBHI steering committee that will help us to deepen the scalability of CBHI here in our environment. The second question was from our father, Dr. Freeman Miri, about the involvement of local government authorities in collecting taxes. Now, we have said this abundantly here, that we have worked very closely with the local government chairman in seeing how we can deepen health insurance coverage in Plateau State. As a matter of fact, at the moment, we are enrolling poor and vulnerable individuals across the 17 local governments by virtue of contributions gleaned by the agency from the 17 local government areas of Plateau State. So we're going to deepen our engagement with them to see how we can together contribute to deepen health insurance coverage in Plateau State, thereby providing financial risk protection for our people. The third contribution was about whether we should include health maintenance organizations in our operations. At the moment, we actually use health maintenance organizations. But you will all agree with me that HMOs are actually capitalists. They are business people, and they have, instead of adding to the quality of the services that we render to our enrollees, they have actually, in a way, scuttled the quality of our, is going to actually elapse at the end of August. We are planning on actually severing them and managing the entire gatekeeping process at the level of the agency. It is estimated that when we do that, we are going to profoundly improve the quality of services that we render to our enrollees. The fourth question from Sir Philemon Dagwa was about commencing conversation with the National Identity Management Commission.
Please let us be mindful of time.
Well, I'm actually dwelling like this because most of the questions were targeted around us, and then the theme of this entire State Council on Health centered around what we do. So it is essential that we actually exhaust the issues that are raised and targeted at us. So about our engagement with NIMSI, we have had several engagements with NIMSI, and we have reached a stage where NIMSI has agreed to train our officers to become enrollment officers for NIMSI for the purposes of assigning the national identity number for all our enrollees. Thankfully, again, we have had support of the United States Agency for International Development through their local health system sustainability project. They have actually procured those gadgets that have been certified to be able to issue NIN to our beneficiaries. So the training for our officers is likely going to come up in September. So when we do that and we make proper use of these resources that we have at our disposal, we are definitely going to be able to assign NIN to our beneficiaries, thereby providing data that can be universally accessible and verifiable by all stakeholders. Thank you very much.
Thank you for answering the questions. Now we are going to take our recommendation on each of the memo that have been presented. We will now take a recommendation to the council. I will now take the first one, that is memo 22, strategic adoption of the Ghanaian model of community-based health insurance as a catalyst for achieving universal health coverage in Plateau State by 2030. What is our recommendation to the council? Step down, approve, or otherwise?
I hope we got the question. Apology, I wasn't here when it was presented, but the PAMSEC has put the question. It's either we are taking it or otherwise. I think the little I have heard from the little I've heard, the Ghanaian model that we are talking about, do we think it is sustainable? It can be applicable to Plateau State? Can we make it as a recommendation and work towards it? We can make it as a recommendation. So we'll take it to council for consideration. The second one, similar to it, enhancing healthcare access and allocation in the basic healthcare fund, targeted community-based house-to-house beneficiary verification. Taken? Recommended. Where are the other ones, sir? So the one from M1, adoption of the e-motive bundle as a cost-effective innovation to reduce maternal mortality from postpartum hemorrhage in Plateau State. I thought the little I heard was that they should also liaise with primary health care. The emotive actually cutting across primary health care and even secondary health facilities. The provost of VOM, is he here? Sambo. Sambo is not here, but already they have put in place a mechanism of training health workers in the state on emotive. It's a WHO model, which is very, very good, that if our health workers can be properly trained on it, it will actually help. But I think we can pass it and allow administrative consultation with primary health care and even the CMD of Hospitals Management Board, so that they can sit together and see how we can integrate it, because School of Nursing VOM have started it. His Excellency has approved for them to do the training. So I think it will be good for us to consider it. Is it taken? It's taken. So please, yes, this is very important. Let us with the M1 so that we do it together. Then the where is it? Okay. HIV sustainability and scaling up. I didn't say the... From donor dependence to durable state-led care. Was that from PLACA? Okay, APIN. Okay. Is it taken? PLACA. Please, let's get the correct perspective. Please, where is the mic? Okay.
Sorry. Okay, I was saying that it's not just sustaining, you know, the HIV program. We had, you know, conducted, you know, like a kind of a mapping to come up with a state HIV trust fund. But, you know, with the integration and, of course, the dwindling of funding and all that, we felt that, you know, we would have gone ahead. But then with this, with the service integration and all that, we need to come together and look at, you know, the health component. If we are going to talk about sustainability, it's not just about HIV/AIDS, and
Yes.
also that we are coming from the 7th National Council on AIDS. These were issues that were resolved at that council, and it will be taken to the National Council on Health. You know, it will be presented there. So I want us to look at this holistically, not just sustaining the HIV program. There were issues that were raised for other diseases as well. So I think we should look at that. Maybe we should, I don't know, maybe step it down for now.
No, I agree with you. I agree with you. So I think that EPIN should liaise with the ministry, with PLACA and other stakeholders, particularly integrating malaria, TB, HIV, and the rest of them, so that we come up with something holistic. And going forward, we can now integrate properly and make it like a policy. So for now, we'll step it down and look at it maybe at next council meeting. Agreed? Agreed? Thank you. Okay, then the scaling up adolescent youth-friendly HIV services and operations for improving HIV treatment outcomes among children and adolescents. Are we following the same line? PLACA, is it the same? The scaling up? SASCAP, is it the same? Please, let's give SASCAP. Epin, you want to say something? So let her say something, then you can.
No, sir, it's not the same thing. Though if we are talking of sustainability, it's all inclusive. But we need to look carefully into the pediatric population, because that's where the majority of the gap is. So I think it's something that we're supposed to comment it for us to sit down and come out with strategies that will enable us to have a HIV-free generation. As you know that, yes, for the most especially the pediatric, adolescent, and PMCT, they work hand in hand. And it's the national, from the Federal Ministry of Health, that they are coming to state to support some of these services. So the state needs to own it and continue it from there. So my suggestion is that that memo should be taken. Thank you, sir.
Thank you. Yeah, Epin.
Permanent Secretary, sir, I want to support power. The way the funding landscape...
Sorry, if you are supporting, it's okay.
I just want to make a point. The way the funding landscape is changing very, very rapidly. If we are not prepared, we'll run into trouble. The issue is expansion. We can quickly expand it. It's HIV sustainability and other health programs sustainability, so to speak. We can just add it, and it covers every disease of public health interest. Next year is too far, the way the development space is changing rapidly.
So it's a scaling up program, and I think it's ongoing. So we are just trying to make it better. We can even add what he's saying to it so that it makes it bigger. So I think it's taken. Agreed? Then the memo by our honorable member on a law to provide for the establishment, development, regulation of health management information system, diseases, genomic banking, these other related matters. I'm not sure we need to debate this again. It's very clear. It's already before the House of Assembly. It's for us to just support the law, and I think the law is very relevant. Agreed? So it passed. Thank you very much, sir. So I'll hand it over to the PAMSEC.
Thank you all. It is now time for our tea break. We'll go as we did yesterday, line by line. Thank you.
Sorry, announcement, please. Sorry. After the tea break, we are going to start council session. We will tidy up all the agreements, all the recommendations that we have made during this technical session, so that we will now take them and approve them as part of what this council has taken. Those that were stepped down will also agree to them. So please, yesterday before we left, I outlined council members. Those council members will be in the front, while the remaining will be at the back, because there might be need to take count. There might be need to vote. So please, council members will be in the front, then the others can be at the back, not back, but what I mean is front row, and then the next row follows like that. All of us are still invited to participate, to know the process. Thank you.
There's a missing item here. Yesterday, someone forgot his journal after having lunch. Can we project that?